Currently, for patients who have chemotherapy-sensitive disease, autologous stem cell transplantation remains the treatment of choice, but there is strong evidence that CAR T cells could be superior to them. There are currently trials ongoing internationally. There's 3 large trials that are actually comparing CAR T cells to autologous stem cell transplantation in high-risk patients, patients who relapse within the first 12 months of initial therapy or are primary refractory to initial therapy. And I will have these data within the next 1 to 2 years. So at our institution, we have a large number of trials with CAR T cells for diffuse large B-cell lymphoma. So we're looking at various combinations. We actually have a standard autologous CAR T, anti-CD19 CAR T, where we're investigating it with a checkpoint inhibitor because there is known that the T cells, that the lymphoma can actually develop resistance to the T cells, and the checkpoint inhibitor can overcome that. We actually have an off-the-shelf allogeneic CAR T cell. And this actually, we think, could be highly beneficial in terms of that patients wouldn't have to wait to have the CAR T cells produced. But what I think is actually more important is that these are healthy T cells, because the T cells that we are currently using right now undergo a high degree of toxicity from prior therapies, which may affect their health and function. And there is a growing number of studies that are demonstrating that the health and function of T cells correlates with the degree of efficacy that is observed with CAR T cells. So one of our large areas of interest in research is in improving the health of CAR T cells in the autologous setting, but allogeneic CARs could actually solve all those problems.